many people lose weight and then they stop it. After some time, they start gaining weight. This particular program is addressing the gut health first. The problem was like I had this severe stomach pain and bloating issues in the stomach. RAKO team used to monitor my weight, eat rice on a daily basis and still lose weight is a surprise to me in the whole program. Sleep quality has improved quite a bit. Okay, earlier I used to struggle a bit to get sleep and all. I find something, I can stop myself from eating even if I like it a lot, or actually help me, follow the process and trust the process. I was looking for a diet program which could help me reduce weight. I wasn't finding anything that is reliable, and most of the programs that I found are like they are either the same kind of routine for everyone, which doesn't work, and then they are mixed with some physical exercise and diet, and which does not make enough sense, like whether what is helping me to lose the weight or whatever, right? So while I was searching for this kind of a program, so I heard from my brother-in-law that they have this RAKO Health team, and then like they guide the people to reduce the weight through food, and identify some inflammatory foods for each person specific to their kind of own body composition or whatsoever, and then which would finally result in as a weight loss byproduct as well, right? So my brother-in-law, he followed it for like few months and some good results. He used to tell us on a regular basis, kind of daily or weekly kind of discussion we used to do. And then while this was happening, so I was thinking of joining, but my schedule wasn't allowing me. So I was waiting for the right time that I can join, so that like I can balance my work and this one and all that. So during that time, like one of my colleague also, he came to me complaining that, okay, I kind of did fasting for like a month, and kind of some intermittent fasting, some kind of thing that he said that. Okay, so I did for a month, but I did not lose any weight at all. I don't know whether I'll be able to lose weight ever. He was like kind of very sad. Suggested him, boss, I heard of this program, my brother-in-law is doing it, so maybe this will be of help to you. Evaluate this, and then accordingly you can join and get some benefit out of it. So then he joined. Like in a month's time frame, he lost about 8 kgs or something like that. So then he started being very happy. Okay, fine. Is that like a significant number of colleagues from my brother-in-law's company has joined this program, got benefited, and even after 2 years they are able to manage the weight, which is the main important point for any weight loss program, right? So because many people lose weight and then they stop it. After some time, they start gaining weight, which doesn't make any sense. After like this much effort, if you are going to gain the weight back, then it doesn't make any sense. So that's what led me to think that definitely this program has some reliability in it, so I can join and make sure that I get some benefit. Initially, when I consulted the Dr.M.Chalamaiah Garu and started this program, so he suggested for a few blood tests, which are about some 120 parameters and all that, and then identified what exactly are the problems that you have. Okay, and then identifying those deficiencies and all, listing them all. And then other than that, they also do a consultation of like what all the health problems that you have, and then listing them down, and then accordingly start your diet program. It's kind of makes it specific for you, and then make sure that those problems are addressed, and then make sure that you. So I started with around 84 kgs of weight, and then I did this program for 3 months, about 90 days, and then I lost about 16 kgs and came to around 68 kgs. Okay, so initially I was thinking that okay, losing weight at this level is really difficult, and at the max I can probably lose 10 kgs, and beyond that it will become very tough to lose any weight. But yeah, I don't know how, but this program certainly helped me lose more than what I wished for actually. So what my observation personally is that so initially there was like kind of some preparation period where we reduce the overall quantity that we eat, which is definitely gives us some mindset that we are overeating so far. Okay, so that's where my observation was that, and for a few weeks after that there are different phases that this program follows. They monitor our weight every day, and the team they do a very close monitoring and very close follow up for any questions and all. And then so even if like we feel hungry at any time during the day, we can immediately ask for a suggestion and gain that what we should eat or what would help us to recover that phase immediately. So that way I find it flexible, and then even a busy professional who has like very hectic timelines like me can follow that. Specifically about identifying the inflammation in the body, what foods are causing the inflammation, which is actually so this inflammation is actually making you gain weight, right? So if you are controlling that part, then you are managing that and then getting your weight down. And then after that you can avoid those, after identifying those inflammatory foods, you can avoid those things and then manage the weight over the time. That's what is helping more than managing the calories and doing all that exercise. I had this kind of IBS which was troubling me for a decade or more. Okay, so that problem was like I had this severe stomach pain and bloating issues in the stomach and all. So I used to have sleepless nights because of that. This particular program is addressing the gut health first. So because of that, these symptoms and all gets improved and you minimize the trouble. Okay, so and then over the time I observed that so even with the consumption of the same kind of foods that I used to eat before and after the program, I see that the symptoms have not recurred or anything like that. So that actually is a observation I made and feel good about it following this program. Okay, so I did not see any of these phases actually, except for few days or so. I think rice was always there in the program. I think rice is a staple food for where I'm staying, so that is always there, and that is actually a comfort factor for me to consume that daily and make sure that I eat rice on a daily basis and still lose weight is a surprise to me in the whole program. So yeah, I'm a vegetarian, so there is not like too much focus that okay, you should eat only protein, okay, only this you should consume. It has been a focus on like a balanced diet and then make sure that you are on a path to weight loss and avoiding the inflammation foods. Okay, so this is the main concentration that I have seen. RAKO team used to monitor my weight, and then every day morning I used to send the weight and all that, and then the day before they used to send what is the menu for the next day, and then accordingly asked us to prepare food in a certain manner. I think hardly one thing that changed is the oil. That's all. Rest of the things are pretty much the same as what we use regularly. Okay, so I think it is one specific oil for each person based on the problems that they have and all that. Yeah, preparation is pretty much the same, and then sleep quality has improved quite a bit. Okay, earlier I used to struggle a bit to get sleep and all. I used to at least spend some time before I really get to sleep, and then now I think that okay, the moment it's kind of 11 or 12, if I go on to the bed, then I into sleep. That's kind of one good thing I observe, and then I can wake up early as well, so that way and wake up active than tired and all that stuff. The program starts with a set of blood tests and then end with the same set of blood tests. Okay, so what I observe is that from whatever the markers that were there initially from that to this, there is kind of improvement on all those parameters which we found are out of the normal, and these are like really good. And I saw that the lipid profile has improved quite a bit, which is one of my focus in doing this program. So, and then this IBS problem has solved quite a bit. Sleep issues have solved quite a bit, and then even with respect to the anxiety or things like that, that has improved a lot. Okay, and then anxiety used to lead me to overeat at times, and then now I'm able to regulate that. If at all I find something, I can stop myself from eating, even if I like it a lot or things like that. It's not the same diet, right? So, I mean, there is a variety of foods that are suggested every day, and I have observed that there is specific focus that you don't repeat the same kind of curry in a week. That's what I used to get the suggestions, and even if I ask, okay, can I eat this curry? They used to suggest, no sir, go with this one. You have already eaten this in this week, and why should you eat the same thing? That was what I saw that. I would tell one thing. So, do you want to understand your body, and do you want to identify the foods which are not comfortable with your body, right? So, and make sure that you consume less of those foods which are not comfortable and eat those things which you are comfortable, and make sure that your quality of life gets better every day. Definitely this program is something which would help you, and if you are looking to lose weight, probably that will be a side effect, if at all we have to say, right? So that's the main purpose you should join this program for, and then definitely I think you will get good results. And whoever has joined either before me or after me, with all the people I have talked, they all have got results with this, and I definitely see that there is some scientific approach in this program, and that is definitely helping all these people lose weight. So if there is one such thing, then definitely if there is a need for someone to get better health, then they should join this program. They don't suggest any products as such. Based on what are blood reports, they'll suggest probably some supplements if required, and then you consume them, that's all. Okay, other than that, there are no such products that are defined by RAKO Health or anything like that. So as soon as we join the program, team assigned for each individual, and then they start monitoring all the parameters throughout the 90-day program that they have. Okay, I should actually thank my wife for doing all that preparation and everything every day. She used to pack my entire menu in the morning, and then we used to go. And thanks to all the support from my family. Thanks to the team for all such guidance and help and support throughout the program. That was really wonderful. I mean, I see that they have full commitment to ensure that the program is delivered properly to every person that subscribes to it.